Gymnast Shannon Miller captured our hearts, my heart included, as well as 7 Olympic medals with her fearless talent. And at the age of 33, a diagnosis of ovarian cancer presented even more challenges. I am honored and so excited she joins us now to talk about her experience and the importance of something called biomarker testing. Professor and Director of Gynecologic Oncology at the James Comprehensive Cancer Center at The Ohio State University, Dr. David O'Malley is also here. Welcome both. I'm thrilled to have you guys. Nice to see you.
Thank you so much.
Absolutely. Now, Shannon, I've heard ovarian cancer can be sort of hard to detect from a lack of symptoms. And I just want our audience to know, did you have any symptoms at all? If so, what were they?
At the time of diagnosis, I would have told you, no, I didn't have any symptoms. And that's one of the reasons why I'm such a big advocate, because I actually had 3 of the primary symptoms. Bloating, I had been having stomach aches, I had some sudden weight loss, but I attributed those things to, just the normal everyday things that women go through.
Right.
And my son was only a year old. So I was, I had just had a baby, and I didn't know what to ask. I didn't know to tell my doctor about these things. I just brushed them off, and I don't want other women to do that. Bless
you. Honestly, this is so important because knowledge is power, especially in the medical field. Shannon, what do you wish more women knew about ovarian cancer? What do you feel?
It is so important to know that there is no routine test for ovarian cancer.
Wow.
And that's why we have to listen to our bodies. We've got to speak up when something doesn't feel right and keep speaking up, advocate for yourself. And that's one of the big reasons why we're here in partnership with ADVI to really encourage women with ovarian cancer to ask about every tool, speak up, and that includes biomarker testing, which you mentioned. And that is a great way to potentially unlock this personalized care for specific types of ovarian cancer.
Oh, wow. This is important. Doc, thank you for being here. What exactly is, I'm kind of, let's say I'm not new into this medical terminology. What is biomarker testing?
Well, biomarkers are things that we can target. Okay, so we have our genes, so we have our DNA, what makes up our body, all the cells in our body, all the organs. But then we now can test the tumors. We can test the cancer cells to see if we can target these biomarkers. Some of those common types of ovarian cancer biomarkers are BRCA1 and 2, HRD, folate receptor alpha, and Lynch syndrome, and lots of other targets that we can look at. And by identifying these unique targets, we can then find the therapy that works best. We can personalize that therapy so that we can hopefully help more patients at the right time.
It's almost curated, which is so much smarter in technology. Dr. O'Malley, why is it so important for patients with ovarian cancer to understand and receive biomarker testing?
Well, unfortunately, most women with ovarian cancer are diagnosed in advanced stages. And even though we're doing a much, much better job of curing more patients, still as high as 70% recur. In Colorado, there'll be about 300 patients diagnosed with ovarian cancer this year, but that is a complete underestimate of the patients who are living with ovarian cancer in Colorado because the therapies are better. So as I was saying earlier, by identifying these biomarkers, we're able to find the right treatment for the right patient at the right time. So if a patient has been diagnosed with ovarian cancer or their family members have been diagnosed with ovarian cancer, make sure you ask your physician, make sure you ask your oncology team, have I had these biomarkers? And if not, advocate for yourself to make sure that those are looked at.
I can't express how much advocating for yourself, even if you feel a little uncomfortable, is so important in a medical way. It is just, I always say, be a little pushy. I'm a little pushy Jew. You got to get in there, So Dr. O'Malley, ovarian cancer remains the deadliest gynecologic cancer. How can biomarker testing help to change that? Is that by being so specific?
Well, Tori, really when we look at this from the time of diagnosis, we can choose the best therapy at the time of diagnosis to really personalize that treatment. And then upon recurrence, again, looking at making sure those biomarkers have been tested to assure that we're getting the best treatments for our patients to keep them on this earth as long as possible with the best quality of life. If patients want more information about biomarker testing, have them look at biomarkerboost.com. biomarkerboost.com. You can really give more information about biomarker testing.
Amazing. We're making a deal with my viewers right now. We are going to ask for that if you are diagnosed with ovarian cancer. I want to get back to one of my heroes, Shannon. I'm like freaking out by being with you here. But you are such a celebrity. You really are such a beautiful, amazing athlete. But that's one thing. How did ovarian cancer just mentally, how did the diagnosis change your perspective on like real strength and resilience? And what message do you have for women who may be going through this? They're looking at you as a compass. What would you have to say?
Well, I am so thankful to have so many survivors who reached out and spoke to me, and I just hope to pay that forward by continuing to be an advocate in the cancer community. What I want to tell women and their families is that you are never in this fight alone. Find your team. That might be your care team, friends, family, neighbors, support in your local area, but find your team, ask those questions, even if they seem silly. Ask them. Your care team wants to know. They want to partner with you. And finally, I would say there is such strength in seeking that support. So never hesitate to ask.
What a beautiful message. All right, everyone out there, September is Ovarian Cancer Awareness Month. All three of us want you to talk to your doctor, stay up to date on all your screenings, and remember to be pushy even if it's uncomfortable. And as the doc said, learn more at biomarkerboost.com, and it is right on your screen. Take a screenshot, share with your female friends. This could save a life. This interview is sponsored by AbbVie.